I'm here with Dr. Dean Winslow. He is an infectious disease physician with Stanford Healthcare and a professor at Stanford University. Thanks so much for being with us this morning.
Well, thank you for asking me to participate.
The CDC recently caused a big stir about a week ago when it put some information on its website and then took it off. And it was all about how infectious airborne coronavirus might be. Where do we stand with that right now? Let's just clear it up.
Well, first of all, want to put out the caveat that, I'm not a specialist in terms of the physics of small particle aerosols and things like that. But if you look at some of what are referred to as super spreader events, they've almost always been in the setting of crowded indoor environments, not associated with outdoor protests and things like that. So it has been shown that these small particle aerosols, which can contain many copies of the virus, can remain suspended in the relatively still air indoors for up to 3 to 4 hours. So I think most of us, that are in this field, feel that small particle aerosols are an important way of spreading the virus from one person to another.
And where do you stand with surfaces right now? I think there's been a lot of fluctuation in that recently.
Yeah, there's actually very little data to support that acquiring the virus from environmental surfaces is an important way of transmitting the virus. So, I think if anything, not that keeping things clean on the surface is not important, but probably in terms of the big scheme of things, since we know that this is a virus that's spread largely by person-to-person transmission through the respiratory tract, that environmental cleaning, while important, is probably of secondary importance to the things that we're doing to try to reduce airborne and droplet transmission of the virus.
All right, doctor, I know a lot of people are itching to travel these days. I'm among them. A lot of airlines are taking special precautions, but what do you tell people when they ask you, is it safe to travel right now?
Yeah, well, interestingly, one of the things that I've done in my, long career is I served as a flight surgeon in the United States Air Force for almost 35 years. And actually, I can reassure people that the quality of air inside the cabin of modern jet airliners is incredibly clean. The exchange rate of the air is very high. At least Boeing and Airbus aircraft also employ HEPA filtration, as part of the normal cycle to clean the air. So actually being on board the airplane is probably a relatively low risk environment. The only situations where I'm aware of where airborne pathogens have been transmitted from person to person on airplanes have been on very long flights, and it's usually confined to just a row or so in front of the person or behind the person, or the person literally seated next to them. So one of the things that I'm very interested in is, if the airlines want to start packing the planes more full again, which I'm sure they do from a cost standpoint, would actually be the idea to incorporate basically a screening test for SARS-CoV-2 within, let's say, 3 days of travel. And that would actually be included in the price of the ticket. It's kind of a crazy idea, which actually my wife kind of came up with. She actually is an infectious disease epidemiologist at Stanford.
So perhaps airplanes are not that big of a concern, but what about, I guess, airports? And then what do you need to think about when you get to your destination?
Yeah, so again, the normal, I think, precautions should apply, and I certainly encourage everyone to wear a face mask for not only protecting other people in case the person wearing the mask is asymptomatically shedding the virus, but also there's a growing body of evidence that these masks, while not specifically designed for that purpose, also provide some degree of protection to the wearer as well. And a number of different studies have modeled this and shown that, if everyone wore a mask, at least in the indoor environment or where you cannot maintain 6 feet of distance outdoors, that we would have very significantly fewer cases. So big believer in that. And of course, wash your hands frequently, when you're traveling, or use hand sanitizer as well.
Okay, but you don't have any particular concerns about somebody taking a flight somewhere?
I think, again, it's certainly higher risk than, being, alone by yourself or being in an outdoor environment. But I think in the big scheme of things, it's much, much lower risk than certainly things like dining indoors or going to a bar or something like that.
Okay. Speaking of travel, parts of Europe right now are seeing surges in coronavirus cases, some reconsidering lockdowns. But at the same time, we're looking at what's happening in Sweden. They've rejected lockdowns and they're seeing a drop in cases. What do you make of that?
Well, it's kind of interesting, and I read that Washington Post article, I think just this morning, that was sort of talking about that. So cases are actually starting to surge again in the United Kingdom and also in Spain. And from my understanding is it's largely being driven by young adults. Again, the situation in Sweden, they actually, though, did not do as good a job as other Scandinavian countries that did impose lockdowns. For whatever reason that their rates are staying relatively low, it may have, to some extent, have something to do with just the relatively lower population density in Sweden than perhaps in the big cities in the United Kingdom and places like Madrid.
Now, of course, everybody is waiting for a vaccine for the coronavirus. We've been hearing a lot about the race toward one. Where do things stand? And also, I've been hearing some interesting facts about vaccines in children.
Yeah, so a couple of things I think, just to say about that, there are 3 or 4 lead candidate vaccines, being trialed in the US and Western Europe. And my own personal opinion is I believe all of them are going to be safe, but they may vary in efficacy to some degree. And we'll need to really wait for the results of phase 3 efficacy trials to really determine, which of these vaccines is the best. But I personally would have no concerns about really taking any of them from a safety standpoint. But again, we just don't have the data yet to know, which vaccine will be the most effective. And then, of course, we do want to get this rolled out as soon as possible. So we may end up, having production spooled up for perhaps 2 or 3 of these vaccines once at least we get preliminary efficacy data in.
And it sounds like it might be a longer wait for children than adults, ultimately.
Well, again, I think the vaccines will be safe in children. Again, doing clinical trials in children is certainly very doable. We've done that with other drugs, including HIV drugs and things. But I think maybe what you're thinking of is just the priority probably for giving the vaccine, children, because while they can become very ill, just statistically have a much lower rate of serious illness and death than middle-aged and older adults. So, my sense is in terms of the prioritization that children will be probably pushed back toward later next year, whereas, high-risk individuals can and should receive the vaccine probably initially when the supplies are still limited.
All right, Dr. Dean Winslow with Stanford Healthcare. Thanks.
Okay, thank you, ma'am.